wash my hands, apply my gloves. In this video, and I'm going to clean my stethoscope. I'm going to ensure that my patient surrounding is clear from all sharp objects and all clutter, and is comfortable and is surrounding safe. And before I do so, my name is Stephanie and I'm here to do an X2 assessment on you. Before I do so, can I get your name and date of birth, please?
My name is Nichole and I'm born on September 3rd, 2003.
Thank you. May I get the consent before I do so, sir?
Yes.
I ensure I provide privacy. Nichole's physical appearance, his color is normal and there is no odor. His body posture, his body structure, is height and build is appropriate for his age, and there are no physical deformities, and his posture is symmetrical. Now I'm gonna assess for his behavior. His mood is sad, and also his speech and dress code is appropriate, and he maintains an excellent eye contact. His mobility, can you stand up for me, sir? Can you walk over to me? Can you go back? His gait and range of motion is also symmetrical. There's no involuntary movement. Now I'm going to continue to assess for his work of breathing. His work of breathing is normal. He shows no signs of distress. He left of consciousness. Sir, are you awake?
Yeah.
Do you know where you are?
Yes.
And where are you?
In the hospital.
And do you know who I am?
Yes.
And what day, do you know that today's date is?
December 3rd, 2020.
Thank you. He is conscious, he's alert, he's awake, and he's not sleepy, and he's orientated to person, place, and time. Now I'm going to inspect further here. Can you cross the mixer? There's no lump, there's no lesion, and also here there's no deformities, and there is no swelling. Now I'm going to continue to inspect the hair. The hair is dark, the color of the hair is dark brown, there's no infestation, and also the hair is not evenly distributed. Now I'm going to continue to inspect for the cranial nerve number 7. Sir, can you smile for me? Can you show your teeth? Can you lift frown? Can you lift your eyebrow? Can you close your eyes tight? Can you puff out your cheek? And face is symmetrical. Now I'm going to continue to inspect for the eyes. The eyes here, lashes are even. Open your eyes. Here is white, and I'm going to inspect cranial nerve number 3, which is oculomotor. Eyes are shape is rounded. Both eyes are measured 3 millimeter each, and there is no ptosis, no leg log, and no discharge coming from the eyes. Now I'm going to check for direct light reflex. Concentrate. I'm going to move to the left. Okay. And the pupil is concentrated to light. Now I'm going to check for accommodation. When you look for the light, please. The top of the pen, the light. And the eyes are midline, and his accommodation is present. Now I'm going to continue to inspect for the hair. I'm going to inspect for the auricle and the trigger. Are you feeling any pain, sir?
No.
Any tenderness?
No.
And the hairs are symmetrical, and there's no discharge coming from the hair, and also the auricle and the trigger, there's no tenderness. Now I'm going to continue to inspect. I'm going to speak into both ears 3 different words. Whatever you hear, can you say it back to me?
1, 2, 3. Red, blue, yellow.
And the patient here bilaterally. Now I'm going to continue to inspect for the nose and sinuses. The nose is midline. There's no discharge, and there's no potency of nasal passage. Now I'm going to continue to palpate for the frontal and maxillary. Are you feeling anything, sir?
No.
Of the maxillary? Are you feeling anything?
No.
And there is no signs of pain or tenderness to the frontal and maxillary. Now I'm going to continue to inspect for the mouth and pharynx. The lip is hydrated, color is normal. Can you open your mouth, sir? I'm gonna act as if I'm gonna put this in. The 100%. Can you open your mouth, sir? The gum, there is no swelling and there is no bleeding, and the teeth, they are present and there is no looseness to the teeth. And open your mouth, sir. Your mouth. The tongue and base of the tongue, there is no lesion, color is normal. And for the hard palate, hard and soft palate, there is no lesion, color is normal. I am going to assess for cranial nerve number 10 and 9, which is the vagus. Say huh? The uvula is arise well when the patient say huh. I'm going to check for cranial nerve number 12, which is the hypoglossal. And mouth. Can you move it from side to side? Can you say light, tight, and dynamite?
Light, tight, and dynamite.
The tongue is midline and the patient is able to move tongue from side to side and there's no tremor. Now I'm going to continue to inspect for the neck. There is no color is normal, no discoloration, there is no scars, and also there is no edema, and also there is no tenderness. I am going to, there is no masses, there is no tenderness, there is no swelling, there is no lesion. Also, I'm going to check for the carotid pulse. I'm going to hold for 1 minute. And the carotid pulse, the beat is 60 beats per minute, the rhythm is regular, and the strength is +2. Now I'm going to continue to inspect the cranial nerve number 11, which is a spinal accessory. So can you turn your head to the right and to the left? Can you shrug against your shoulder? And the shoulder is symmetrical. Now I'm going to inspect and palpate for the upper extremities, which is the integumentary and the musculoskeletal system. So now I'm going to check. Can you take this off, please? For the arms. No, you need to go massive. There is no lesion, color is normal, there is no edema, and there is no muscle bulk. I'm going to palpate. Are you feeling the pain?
No.
There's no tenderness or pain, there is no swelling or edema, and there is no lesion, and temperature is warm. I'm going to also check for your finger, assess your finger, inspect your finger. Sorry. Finger, the color is normal and there is no lesion. I am going to test for the active range of motion. Can you stand up for me? Can you stretch your hands out? Extension, flexion, extension, flexion, extension of the fingers. I'm going to flexion, extension of the wrist. Flexion, extension, flexion, extension, flexion, extension. I'm going to do likewise with the elbow. Flexion, extension, extension. Thank you. And we're going to do radial and deviation, radial and ulnar deviation, radial deviation, ulnar deviation, radial deviation, ulnar deviation. Now we're going to do supination, pronation, supination, pronation, supination, pronation, supination, pronation. We're going to do abduction, adduction of the arms, abduction, adduction, abduction, adduction, and we're going to show your shoulder. Okay, then you're going to do external and internal, external rotation, internal, external, internal, external. Thank you. You may see there's no involuntary movement and patient experience no form of pain when testing active range of motion and follow instruction very well. And now we're gonna uncross your legs. Inspect for the, I'm gonna assess for the radial pulse. I'm gonna hold for 1 minute. radial pulse is 60 beats per minute, and also the rhythm is regular and the strength is +2. I am going to assess for hand grip, and hand grip is strong bilaterally. Now I'm going to assess for the lower extremities. Dorsal pulse. I'm going to hold for 1 minute. And the dorsal pulse, the beat is 60 beats per minute, and the strength and the rhythm is regular and the strength is +1. I'm going to do for the tibial pulse. I'm going to hold for 1 minute. And the tibial pulse is 60 beats per minute, and the rhythm is regular and the strength is +1. I'm going to continue to inspect. There is no involuntary movement, there's no scars, and there is the color, there's no abnormal colors, the color is normal, and there is no swelling observed. How about pain? Are you feeling pain or tenderness?
No.
There is no lesion, and there is no tenderness or pain, and there is no edema or swelling. So I'm going to wash my hands. But before I wash my hands, I'm going to do some dorsiflexion and plantar flexion. Sir, can you do some plantar flexion, dorsiflexion, plantar flexion, dorsiflexion, and strength, and it's strong bilateral. I'm going to wash my hands. I'm going to inspect the posterior thorax. The posterior thorax is the midline, and there is no lesion, color is normal, there is no scars, and there is no signs of visible masses. Are you feeling the pain, sir?
No.
There's no tenderness or swelling, there's no edema, and there is no lesion, and the temperature is warm. Now I'm going to feel it for breath sound. And the breath sound is 14 beats per minute, and the rhythm is regular, and there is no wheezing, and there's no crackle heard, and there's no other abnormal finding. There's no abnormal findings. So I'm going to continue to do the anterior thorax. And there's no scars. There's no scars. There's no color is normal. There is no edema or masses observed. So now I'm going to check for the excellent sound, art sound. Starting from the right sternum border, second intercostal space, the aortic valve. To the left sternum border, second intercostal space, the pulmonic valve. Go to the left sternum border, third intercostal space, the Herb's point. Down to the left sternum border, mid clavicle, fifth intercostal space, the mitral, the tricuspid valve, and over to the left sternum valve, fifth intercostal space and mitral valve. And because I'm at the mitral valve, I am going to assess for the apical pulse, and I'm going to hold the stethoscope for 1 minute. And the beat is 80 beats per minute. The rhythm is regular, and there is no irregular pulse or sound. And at the S1, the heart rate is best heard. S1 is best heard at the apex of the heart, which is the tricuspid and mitral valve, and at the S2 is best heard at the base of the heart, which is the aortic and pulmonic valve. Now I'm going to walk over there. Actually, I'm going to assess for your abdomen, the bowel sound, abdomen. Now I'm going to inspect for the abdomen. Sorry, I'm going to inspect for the abdomen. Privacy. Nice. Up a little. And there is no color is normal. There is no scar. There is no scar. There is no lesion, and also there is no signs of masses. So I'm going to look for the bowel sound. Starting from the right lower quadrant to the upper right quadrant, across to the upper left quadrant, and down to the lower left quadrant. The bowel sound, there's girdle sound, and the bowel sound is normal. And now I am going to assess for if there's any pain. Palpate for any pain. Are you feeling any pain?
No.
Any pain?
No.
Nothing? Okay.
No.
There is no masses, and there is no tenderness or swelling. There is no edema, and there is no other signs of visible masses. Now I'm going to inspect for the blood. I'm going to light palpate for the bladder. Feel any pain?
No.
As for the bladder, there's no discomfort, no tenderness, and also there's no distension of the bladder. So everything seems to be in the normal range. Thank you.